So we'd like to know a little bit more about who you are and why you're here. And did you listen to the plenary? Did you all listen to the plenary session that I gave? Because if I did, I don't want to repeat it, but if you didn't, maybe I'll sort of go over a little bit of it. So Paul, why don't you start by telling us who you are?
Sure. I'm in Michigan. I'm the secretary for the Michigan for Single Payer Healthcare Organization. I've been involved in the single payer movement for about 3 or 4 years, and I have knowledge gaps, one of which is involving the veterans. That's why I'm here. And also tribal health. I have some tribes Indian tribes in my area. So I want to educate myself more about that, but that's not related to your topic today. But that's why I'm here in a nutshell.
Great. And did you by any chance listen to the plenary I gave with Bruce Carruthers?
Well, I was watching the plenary today. We had the Minnesota nurses person speaking, and then the 2 Healthcare Now people speaking. That's the only plenary I caught.
Okay, and because I did something with Bruce Carruthers on, and maybe I'll just sort of summarize it, and then Kyle and I I'll just ask Kyle some questions, and that'll cover some of it. But I would suggest that if it's possible for you to go back and watch that, it might help. And Karen, could you tell us a little bit about why you're here and who you are?
Sure. Let me turn my,
Yeah, I'd love to see you. It'd be fun.
Yeah, there you go.
Yeah.
So I'm the healthcare organizer for Citizen Action in Wisconsin. And I talk to people about Medicare for all the time. So I love hearing other people's presentations and just picking up, like, there might be a little fact that I hear that I like. If I encounter someone that asks me a question, I like to be ready. I've taken trainings with NNU. I've taken trainings with lots of, like, I've attended PDA trainings and things like that. So I've never really had an in-depth conversation about the subject of veterans. I'd like to hear someone do one about unions, because there's some unions that are also against Medicare for All. And I'm a huge union person. And I want us to be careful how we talk about them opposing it too, because I've been in some calls where people were kind of degrading unions for not supporting it. And I was like, oh, you got to be careful there. You're sounding like Scott Walker a little bit. So I'm so excited, and I'm sorry I'm late. I all of a sudden had to update my Zoom software, and I've been using it forever. All of a sudden it needed to update right when I was trying to join.
No problem. We're just glad you're here. So let me ask you, Karen, when you've done these trainings on Medicare for All, has anybody mentioned the VA?
No. And so my husband is a caseworker for a congressperson, and he works with vets, and he has lots of interaction with the VA. So I actually have, just by nature of my relationship to him, I have a little bit of knowledge of the VA, and I know that there's like appeals process, and I just have a little bit more than average probably information about the VA, but I could always hear more. I can always hear different angles as to how to talk to vets too.
Great. Well, we hope we'll teach you some things or have an interchange. And we have Kyle here, who is an Iraq vet and works with Common Defense, and let's sort of introduce each other. I want to just, because I think this is important, and if you and I would try to go back and listen to to the plenary if it's possible. But what I essentially argued in the plenary is that, you know, a lot of people think that veterans are sort of a monolith, and that they're all kind of right wing and militaristic, and they would be opposed to Medicare for all, you know, because they'd be opposed to anything progressive. And we're here to tell you that, you know, while they're obviously just like the rest of America, you know, right-wing vets and left-wing vets and middle-of-the-road vets, that, you know, veterans are not a monolith, and they're a small constituency because of our all-volunteer Army. We have only about, what is it, Kyle, 1% now of people in military service, and maybe vets are what is it, 10% of the population? I don't know, 7%, 10%. What is it, Kyle? Do you know?
It's a pretty small percentage, you know, I'm sorry, off the top of my head, I can only remember, I think, the number of Black veterans, just because I started a nonprofit specifically for racial justice, which was 2.5 million. So if you think about that and then tease that out to the entire population, you know, you're talking millions and millions of veterans who are in this country. And
yeah, there's 19 million.
Yeah.
And so, you know, that's about, I don't know, 7%. But the point is that, you know, when you add in their families, that's another, I mean, if there's 19 million vets and you conservatively multiply them by 2, you know, that's another 40 million. And that's probably incorrect in their community. So we'll talk more about this. But so veterans are a small part of the population, but they are a very politically important part of the population, because they have a lot of moral sway, particularly in their own communities, right? And they have a lot of moral sway. I mean, they are used and abused by politicians, you know, who trot out vets to be for things or to be against them. And in the issue of Medicare for all and other progressive initiatives, vets are often, I would argue, abused or misused as they're sort of trotted out to oppose various kinds of progressive change. In California, there was a veteran who was lobbyist who was hired for a lot of money by Big Pharma to oppose the extension of the ability to negotiate prices with pharma for public hospitals in California. The same guy was hired to, you know, organize vets to oppose rent control expansion. And they're doing the same thing now. Ironically, what they're telling vets is that Medicare for all will dismantle the VA. There's two extremely important reasons why you have to know about the VA and know about the role of the VA in Medicare for all proposals. One is that they're going to vets like Kyle, and they're saying Medicare for all is going to kill your VA, right? Your VA won't be there anymore if you have Medicare for all. Number one. And then they're telling, you know, the broader non-veteran public that the VA, you know, government shouldn't have anything to do with healthcare. And if it does have to do with healthcare, it fails. And the VA is the prime example, right? So the VA becomes a poster child for the broader public, as well as the veteran community, for the myth that, you know, government involvement in healthcare doesn't work. And the VA is the prime example of that. And I want to just read you something that this was in a oversight, House Oversight Committee hearing just the other day, just on Wednesday or Tuesday. And this is an African-American first-term Florida congressman. Okay, hi. Kay Tillow is here, and we'll get Kay to introduce herself in a minute, but this is an African-American first-term Florida congressman, Republican, who is in a Medicare for all hearing and using the VA as poster child for why Medicare for All work. And here's what he says. His name is Byron Donalds. You can listen to the hearing yourself. And he says, here's the deal. We already run a single payer healthcare system in the United States. It's called the VA. It's been plagued by backlogs, plagued by shortages of care, plagued with overspending, plagued with fraud and abuse. We never fix it. We choose not to fix it, but what we're going to say is that the VA system, which we know has not provided the best outcomes for the men and women who have served our country with honor and distinction, we're going to say, instead of fixing that system, we're going to create a much larger system for every American, where our own experience with the VA system has already proved what happens when you have universal coverage. Well, we have here a gentleman who has served his nation with honor and distinction in a way that I don't know if Donalds has, who will tell you in a minute about why he's wrong. But the point is, and this is just one example. I mean, you can go online and look at Sally Pipes. She is the executive director of the Koch brothers founder Pacific Research Institute, which is just a paid VA bashing system. And she uses the VA and the National Health Service in Great Britain as sort of poster children for why this won't work. So, you know, we believe and that the VA, it's not that we believe, we know. I mean, Kyle knows from personal experience. I know from my writing, I wrote a book called Wounds of War, how the VA helps, how the VA delivers health, healing, and hope to the nation's veterans. The studies show that the VA, in fact, contrary to what Donald says, does produce the best outcomes for veterans, does have timely care. Yes, there's backlogs, that's true, but there's also backlogs in the nation's broader healthcare system. Particularly, there's no logs if you're poor, you know, or uninsured. You basically have no care most of the time. But I think we think there's a positive reason to understand the VA and to organize vets. Let me just deal with the VA for a minute. We think there's a positive reason to understand the VA because it's a model of care for America that really delivers way better care to veterans. The VA also serves the nation. Most people don't know this. It's the hub of the healthcare professional teaching system. It trains 70% of American doctors and trainings, nurses, psychologists, et cetera. Without the VA, the healthcare educational system would collapse. It's the biggest research, one of the biggest research arms, the biggest after National Institutes of Health, and conducts, you know, research because people like Kyle, you know, go into the VA from discharge and stay till they die. And so you have huge stable population that you can capture both big and little data on. And then the VA has a fourth mission, which is to serve the nation or a region or local area in times of national emergencies. The VA hospital was the only functioning hospital for Puerto Ricans during Hurricane Maria. VA has helped in wildfires, et cetera. And the VA played an incredibly important role during the COVID-19 pandemic, where VA hospitals opened inpatient wards in hotspots to non-VA patients. They sent staff out all over the country, and that's the fourth mission. And, you know, VA research, I mentioned also, you know, it's not just for vets. I mean, my first shingles shot, thank you, VA, they developed the shingle shot, you know, nicotine patch, first implantable cardiac pacemaker. It's not like Kyle is the only one who can get a pacemaker. Anybody can benefit from that research. It's not proprietary. And, you know, they have models of clinical care, the integration of mental health and primary care, coordinated care. The VA is really the only healthcare system, and maybe Kyle can talk a little about this personally, where you kind of get one-stop shopping and coordinated care. And the VA has developed the VA, to answer your question, Paul, has developed the first and best electronic medical electronic medical record in America. It's still the best, et cetera. And of course, care coordination isn't just about reading notes in a chart. It's about people actually talking to each other about complex patients, which they do in the VA. I mean, care coordination is the reason why the VA has better outcomes. I mean, this Donald, it really should be just, you know, assaulted with letters from veterans saying, excuse me, what about the recent study that appeared in the British Medical Journal that documented that vets like Kyle, well, not Kyle, because he's too young, but if a veteran has Medicare and the VA and goes to a private sector emergency room, that vet, instead of going to the VA, has a 20% increased risk of dying in the first 30 days. And then if he goes to the VA emergency room, and that's because care is uncoordinated. They do stuff, you know, that they don't need to do because they're fee for service, they make money. I mean, fragmented care kills people, you know, and that's what we have, those of us who aren't in the VA have in the private sector. When I read that study, I thought, why can't I go to a VA emergency room? I mean, you know, like, I mean, so I'm like any vet who's over 65, I'm 76. I mean, I go to a private sector here. What a great thing. I could, you know, 20% risk of dying because of what they do or don't do. And you know, mental health care is better, cancer care, diabetes care management, dialysis, you name it, there's a study to prove it. And these people tragically are telling vets who aren't in the VA, telling their families, telling all of us that the VA is bad when it's exactly the opposite, exactly the opposite. So, you know, Medicare for All folks really need to understand about the VA because you're going to get this. You know, you're going to get this when you talk about whether, you know, wherever it is, oh, the VA is so terrible, you know, and the Koch brothers spend millions of dollars a year to promote that myth. The other reason to talk to vets is because many vets think, you know, that they're organizing vets, the right wing, to believe that the VA will disappear under Medicare for All, et cetera. That is not true. The Medicare for All proposal leaves the VA alone. In fact, I would argue, and I think Kyle agrees with me, that if you had Medicare for All, and Kyle's going to explain a bit more about why Medicare for All will help veterans. But right now, there's a huge effort to privatize the VA. There's very same people who are arguing that the VA will be dismantled if Medicare for All happens, want to dismantle the VA. I mean, it's hilarious, right? It's the, I'm Jewish, and in Yiddish, there's a term chutzpah, and chutzpah is defined as a kid kills his parents and then argues for leniency in front of the court because he's an orphan, you know, and this is like these guys who want to destroy the VA are saying, oh, Medicare for All is going to destroy the VA. They should be for Medicare for All then, because Medicare for All will serve their aims, but that Medicare for All doesn't attack the VA. And in fact, I would argue that Medicare for All will deny privatizers one of their key privatization mechanisms, which is right now there is legislation that allows veterans, that actually encourages more vets to go seek private sector care. And it's all in the name of choice. You know, these privatizers say, oh, Kyle should have more choice. He should be able to go to any doc he wants, you know, like all of us. They ignore the fact that most of us are, you know, who our doc goes, who we go to for a doctor is determined by our insurer, not by us, right? Or who will take Medicare or Medicaid or private insurance. Only 54% of psychiatrists in America take any insurance at all, right? Because there's enough rich people to pay them $500 an hour for, you know, whatever they provide. And so right now what's happening is that in the name of giving vets choice, they have something called the VA Mission Act. which they passed in 2018, and it allows vets to go to the private sector. It in fact encourages them to go to private sector in certain circumstances. And every time a vet goes to the private sector, that money comes out of the VA budget. So the strategy is starve the VA to pay for private sector profiteering and erode services in the VA. Now, if you had Medicare for all, and vets could go, veterans could go anywhere they want, right? And if Kyle decided he wanted to go to Joe Smith private sector doc down the street, that wouldn't come out of the VA budget. And ironically, and I'm going to conclude on this and let Kyle talk, and then we can maybe have some questions and various other things. But ironically, and I just totally lost my train of thought, so having Medicare for all passed or something like it would stop the cannibalization of the VA. And that's another reason why these folks are so against it. Let me say one other reason why right-wingers are so against it. Right now, and I don't know if this was a factor in Kyle's decision to join up, but right now we know that the primary tool military recruiters use to get folks to join up to the all-voluntary military is not, we're going to go kill a bunch of people and fight a bad guy. But if you join up, you'll get free education after you leave the military, and you'll get free healthcare. And a lot of folks join up for that reason. It's the economic draft, right? And so basically, if you have passed Medicare for all, the military would lose one of its two pillars for recruitment. And I think, Paul, you asked a question about the private, yes, the attacks on the VA, it's the same playbook and the same mechanisms as the attempt to destroy traditional Medicare through, it's really the same thing. You set up these middlemen, you give them all the money, you send people to docs who, have an incentive to undertreat or overtreat and so forth. So I'm going to stop now. And I'm actually going to take a little bathroom break, but Kyle Bibby is I'm so excited to be working with Kyle. I work with Common Defense is just the best. I mean, Kyle can tell you about Common Defense, but it is the best. It's a group of progressive vets trying to fight, military budgets, military adventurism. And Kyle's going to talk about not only, why vets would benefit from Medicare for all. And we're going to begin a conversation about, okay, where do you find vets? How do you talk to them, et cetera, et cetera. So I'm going to just leave it to Kyle right now.
All right. So thank you, Suzanne, for having me. Real quick, if everyone can hear me, right? Or if you can hear me, can you just wave at the screen or something? So, okay, cool. Just want to make sure these headphones are working. So as Suzanne mentioned, I am from an organization called Common Defense. I'm also a Marine Corps veteran. I served about 7 years active duty in the Marines and the infantry. I actually deployed to Afghanistan, not Iraq, but these are all kind of a tied together mess of adventurism, I guess is a way to describe it. But ultimately things that I think a lot of us veterans have questions about how much it actually bettered our community. And if the funds could have gone towards something like maybe our healthcare, right? But just to give a little bit of my background, I went to the Naval Academy. I was commissioned as an officer, so I actually led units in the Marine as an infantry officer. After about 2012, I got off active duty, and I worked for a while actually in the Obama administration at the Office of Management and Budget, just doing some criminal justice, budgetary and program analysis work. Around November of 2016, I decided I didn't want to stay on for the next administration. So I moved over to working on the Hill, doing some advocacy around free press and other things like that, human rights and such, before I settled back in my home state of New Jersey, eventually found out about Common Defense. That organization itself is, you know, Common Defense is a series of different, I guess, like organizations. There's three really. We have our largest, which is what we call the Veterans Organizing Institute. It's actually where I'm at right now in Atlanta. We have seminars where we train veterans to become organizers. This is a nonpartisan space. So we bring in folks who, you know, we've had folks who are in the racial justice movement, people who are in, you know, LGBTQ rights, all across the spectrum, environmental justice, what have you. And I was brought in because of my criminal justice reform and racial justice work. And eventually I was hired by the C4 component, which is called Common Defense. And now I'm the national campaigns manager over there. And, you know, I've worked with Suzanne in the past regarding some of the Save the VA work in DC with lobbying trips. And that really got me tied into a lot of the work regarding, you know, healthcare access in this country. And, you know, for me, initially, I came to it via, I mentioned briefly, a nonprofit I had started with a friend called the Black Veterans Project. We noticed that there's a lot of discrepancy in terms of how the VA is administering care to veterans of color. But within that, you know, it really highlights a greater issue, which is that, and this is, again, what Suzanne really opened about, not every veteran, there's this belief that veterans are all getting so much, oh, the VA is just going to give them, not every veteran gets care from the VA. Not every veteran is given the sort of access that we think that they're getting at the VA. And this sort of, you know, in particular, you know, we found this out when we started the Black Veterans Project. This does have, as you imagine, sort of, it leans in biases towards people with higher incomes, towards higher income communities, and it leans away from communities of color, low income families, et cetera. So women and you know, veterans, LGBTQ veterans. So these access issues are really something that would be greatly remedied if we did really what is the right thing, and we made healthcare a right in this country and a full access, you know, service in this country, rather than the way it is now. So I'll talk a little bit about my experience with the VA, and then just get into some of, you know, what we've done as an organization around healthcare. So when I got out of the Marine Corps in 2012, I had some kind of below the surface issues from Afghanistan that it took me a while to figure out about, and just some injuries having been in the infantry. I was nervous about going to the VA, and being from Northern New Jersey, I went to the East Orange Veterans Hospital, which is my hometown. I was born in East Orange. And I walked in and I was greeted right through the door. They shuttled me right over to the administrators and the staff there. And I always, I tell this story, when I sat down and they started looking at my eligibility, they asked me a number of questions about my service, my discharge rating, things like that. And I was fortunate because the lady across from me at the desk said, okay, you have healthcare till you expire. And I said, oh, okay, well, when does it expire? And they said, no, until you expire. You have healthcare until you expire, sir. And I was like, oh, okay, so, I'm one of the lucky ones. But the fact is, again, not everyone has that. In order for me to get healthcare until I expire, you know, I had to literally go to a combat zone. I had to, you know, deploy and be under incredibly high stress environments, and carry, quite frankly, a lot of that trauma. So the fact is, there are a lot of veterans who have deployed, who might have, for one reason or another, come back with a deep level of trauma from what took place overseas, or not even overseas, because, you know, I don't think we give enough credit for how stressful the job is. You know, actually the worst incident I actually had was in California during a training accident, you know? So, you know, this is a very dangerous job, and you end up with folks who, they carry this trauma, and because of that, they could end up getting discharge ratings other than what I got. So I was fortunate to get an honorable discharge. We have veterans who get other than honorable, less than, you know, bad conduct discharges for lashing out. It's also a very, you know, the military is quite literally an authoritarian place. So, you know, if you end up ticking off the wrong commander, that could end up impacting your discharge rating. And now that is going to affect your ability to get healthcare, right? So again, I was fortunate in the fact that I did get that, that full healthcare access. But there's, you know, again, this belief that everyone gets it, and a lot of veterans are not. And oftentimes the veterans that are not are the ones who might even need it the most because of their circumstances.
Yeah,
Susan,
can I just interrupt, Kyle?
Yeah.
I think just to bring people up to speed, because I think you and I know about this stuff. So basically eligibility, like as Kyle said, eligibility for VA care, and this is not the VA, this is Congress.
Yeah.
Congress does, and really the American people do not want to pay the cost of the military and the cost of war. And so they limit who is eligible for VA care to people, I mean, as Kyle mentioned, a discharge status, right? So there's this thing called other than honorable discharges. There's dishonorable, which is a very small amount of people, but the other than honorable category since 1980 is about 600,000 people. And as Kyle mentioned, it can be given because, you know, you didn't show up from formation on time, you know, you had a fight on the weekend, you got drunk, etc. And they use it to punish personnel, sometimes women who report a rape or sexual trauma, and they get them out of the military, and then they're not allowed to get either the GI Bill or VA care. And so you have a lot of people who have, as he said, you know, serious trauma that can't get care. There's a general discharge where it's the same thing, you know, it's used punitively. Sometimes they can get VA care, but they can't get the GI Bill. So, you know, the good news is the VA puts you together and you're ready to go to college. The bad news is you can't get, you know, it paid for. And then also the GA, you can't get healthcare if your income is too high, amazingly, or if you don't have a proven service-connected disability. And I think Kyle and I would agree that this is ridiculous. We can afford to cover every veteran and we should. And I'm just sorry to interrupt because I just wanted to.
Yeah,
so.
Yeah. No, I mean, and yeah, Suzanne brings up a great point. You know, the actual criteria for this is incredibly difficult for veterans to understand. At the actual point of decision, sometimes can be very arbitrary. But it's because it is, you know, a criteria that was dreamt up by the Congress and then has to be enacted via bureaucrats and doctors and lawyers trying to figure out like what is the best way to make these criteria work. That really, again, wouldn't even be an issue if we had Medicare for all, right? So, you know, the conversation is often about who deserves, rather than, you know, just like, do we have the capacity? Which obviously the answer is we literally do have the capacity to serve all. So, yeah, and you know, just an aside, getting just a little bit beyond the healthcare issue, you know, I think Suzanne brought up an excellent point about, you know, when you serve, a lot of people are joining because they want that healthcare, right? You know, I do not, you know, I don't want to sound like a conspiracy theorist, but I personally do not find it, you know, a coincidence that, you know, the biggest hurdles oftentimes for people moving into secure or really the middle class or, you know, a more secure place financially is healthcare, education, and housing. 3 things that you can get if you serve this country, right? And 3 things that they can take away from you via your discharge rating, right? They'll give you the VA home loans, they'll give you the GI Bill, they'll give you healthcare, but you have to put yourself on the line in this way, then rather than, you know, having this be something that is a lot easier for people across the country, right? And I certainly do think, you know, it's been brought up in the past, if we change how, not even just healthcare, how education is done in this country, every veteran I know jokes, well, they ain't going to do that because now the recruiters are going to be drying up. You know, they're not going to have anybody to show up to get that GI Bill, right? So we should, you know, also just briefly recognize that there's a lot going on here in terms of how this is used as a way to still funnel people into our military. It's still used as a way to really, you know, hold incentives over people and create scarcity on services that really should be universal beyond even just healthcare. But really, you know, I know we want to talk a bit also about, you know, veterans in this. So the misconception, I think, happens around the VA healthcare system. Like, I think it was Donald Byron, I'm sorry, the congressman from Florida, in the quote that was mentioned earlier. There is an ongoing, I think, battle around the image of the VA that very clearly does not include what veterans think of the VA, because consistently surveys from the VA that are taken by veterans show that it's, I mean, I think I saw one in 2020 where literally 90% approval from veterans in their outpatient clinics, right? So like the veterans that are going to the VA are happy about it. And that's been my experience. And to be frank, the fact that the surveys show this, I think is also something, because I don't know. I mean, I've always thought that I usually only fill out a survey when I'm mad about something or when I'm really, really happy about something. And I feel like I want to let them know that I'm happy about it, right? So, but again, when you speak to veterans about the healthcare that they get at the VA, it's pretty consistent that veterans like this healthcare. But even putting that aside, you know, let's be honest, there have been times in the past where some VA hospitals have struggled with issues of maybe backlogs or, you know, whatever. I remember the Arizona VA had issues. But again, this is another issue, I think, in how we've reframed things, because, you know, if you took any other hospital network from across the country, you know, we're talking hospital networks that could have hundreds of hospitals. And you think that, you know, every single hospital has a perfect set of administrators. They don't have any complaints. You know, there's something that happens in how we talk about the VA that makes it seem like, you know, this is just a system plagued with problems, when really, you know, just like any large nationwide hospital program, you may have some hospitals that need to change or work on this or work on that. And I'll tell you, going to the East Orange Veterans Hospital, I love my hospital. I don't want to go anywhere else. And, you know, I think Suzanne brought up a great point that I didn't even notice as being a veteran there, which is that the ease in which I move from care to care. You know, when I go see my primary care, I know that I've literally had my primary care book for me the day that I bring up an issue, a chance to set a meeting with a podiatrist or an allergenist or what, you know, like they have it all present and ready for me. And that ease of transference between, you know, all these different medical providers, I think is what really, you know, ultimately, not just what veterans like, but it's also like what we would ideally like to see out of a system like Medicare for All, where you have that true freedom to move from you know, provider to provider and actually get the care that you need. So, you know, I think that's one thing that we need to start doing when we speak about this, is rather than allow the VA to be, you know, of course, like Donald got it exactly wrong, rather it to be like an example of why single payer healthcare or Medicare for All wouldn't work. It's literally quite the opposite. It's actually the model of why this can work, because we've done this for so long. And I'll tell you, I've been to the American Legions, I've been to the VFWs, Veterans of Foreign Wars. I've been to, you know, all the beer halls with all the old, you know, Vietnam and Korea and World War II veterans. And you bring up closing the VA, you bring up privatizing the VA. These could be Trump voters, these could be far right, libertarian, they don't care about politics, whatever. They stand up for their VA. And the VSOs know this. So, you know, I think that there's fertile ground here for organizing veterans on this issue. So the question is, how do we find the veterans, right? So here at Common Defense, again, you know, we have our two primary organizations, Common Defense Civic Action, which is our lobbying group, of which, you know, I'm speaking with you now from, and then of course our Veterans Organizing Institute, which is more of a nonpartisan institute that teaches veterans how to be organizers, both of which have their own crew of organizers that are seeking veterans to either train them or get them involved in our campaign work, which I run the campaign side of the house. Reaching veterans, admittedly, can be difficult. The reason why is because traditional places where you find veterans, like I mentioned before, the American Legion, Veterans of Foreign Wars, these VSOs that AMVETS, these VSOs that are nonprofits, the members they're very fierce about the sticking to kind of like a nonpartisan stance on things. So certainly, and also they're very careful about what they advocate for, what they qualify as a veterans issue. So again, they'll definitely talk about Mission Act and, you know, what our opponents have deemed like, you know, choice in veterans healthcare. They'll talk about burn pits and the burn pit registry and ensuring that, veterans, if you're unfamiliar with the issue, essentially veterans who, when we're deployed, we don't have garbage trucks. So we dig big holes and we burn trash in it, which of course puts carcinogens in the air, which causes serious issues. So they'll advocate for issues like that. But if you get to something that is politically polarized, like Medicare for All, like these other issues, they're oftentimes loath to engage on it. But that doesn't mean that they don't feel strongly about it. So it's one of those things where those organizations can be tough to find veterans, but I would not discourage people from, trying to have these conversations there or to reach out to these organizations and still engage with the veterans. We believe in, one-on-ones in the deep canvassing model, like we try to have deep conversations with people, really get to the bottom of why it is they support certain issues and don't. So that's one. Second, we've partnered a lot with, I think Karen mentioned that your partner is a caseworker. So it's not uncommon for us to also try and partner with elected officials who are, supporters of the certain legislation or issues that are going to protect this, because again, their caseworkers are dealing with veterans who are directly affected by these issues consistently. So these are folks who, if we can advocate on it ourselves, or sometimes these veterans, let's be real, veterans are not always, but oftentimes a bit, I guess, what you call type A personality. They don't have issues speaking up for themselves sometimes. So sometimes when you explain, we want to talk about, how healthcare can be changed in this country to, provide better care to some of the folks you served with, to provide better care to your family that might not otherwise be covered. They're willing to do that. And it's important because from what we've seen and just getting into the raw politics of veteran advocacy, people trust veterans on issues. So we joke a lot of times that we joke that in terms of being in the organizing space or the progressive movement space, we feel that we're kind of like the special forces of the organizing and progressive movement, because we are not particularly big, but because we can strategically inject veterans into a particular issue and talk about it and how it affects us, it has a really big effect on the people who are hearing this, right? Like veterans as protagonists in certain issues, especially things like ending the war, healthcare. People trust veterans. Their military members and veterans are consistently, I think, the most trusted institution in the country, beyond doctors and police and all these other institutions that we know of that are also highly trusted, right? So getting veterans who can speak out on these issues and who are willing to, stand up for the VA and make the case goes a long way. In fact, some of the data that we saw, I believe when we actually, 2018, this is pre-COVID when it was not not making people uncomfortable to go and knock on their door and talk to them. But canvassing of veterans, we found that you can move independence approximately 10% more if a veteran is advocating for an issue than a non-vet, right? And when we're talking about, independents being oftentimes these swing voters who are going to decide certain sort of issues, this is a big deal, right? Now, in an issue like the VA, obviously there is no greater protagonist than the veterans themselves. But in an issue like Medicare for All, that is when we do start to deal with some of the issues that, I think Suzanne brought up earlier, that, people will say, well, this shouldn't be an issue for veterans, you have the VA. Well, again, that's why we have to break these misconceptions about how many people have accessible care, how many veterans who, had an emotional breakdown after deploying to a combat zone, and it manifests with them getting a bad conduct discharge or an other than honorable discharge, who now have limited care, and a remedy for that is ensuring that we do have healthcare as a right in this country. So I guess, I don't know, that kind of runs down just the first few things that come to mind to me regarding, veterans. I know for us, reaching out to veterans, it is tough, but the interesting thing also about veterans is vets usually know one another, so it kind of becomes like, the tugging on the string that unravels the whole sweater sometimes, so I think leaning on the networks and really just, seeking out these folks within your own networks is a great way to do it, because, from our experience also, there are more progressive veterans who are willing to stand up for the VA, that are willing to stand up for Medicare for All than we know. They just oftentimes don't speak about their service because they might not feel comfortable in an American Legion or a place like a Veterans of Foreign Wars. Our old political director here at Common Defense, his father was at a VFW somewhere in New England, where one of the like actual members of the VFW was a known member of the KKK, right? So as you can imagine, some folks might not have felt comfortable going to that VFW, right? So, and the people who were there, you know, we have to, I don't know, personally as a Black guy, I'm going to deeply question their judgment as to why they would want to be a part of that, you know? So, you know, we should recognize that as well. Finding veterans can be difficult, especially because in certain spaces, it can lean towards, you know, folks who don't want to get engaged on these issues. But anyway, that's just me running down a little of what it's like to organize veterans and you know, our frustrations with how healthcare has been framed against the VA and dispelling some of those myths. So I guess we can go to questions or, you know, just discuss more.
Yeah. Does anybody have any questions or comments or?
Well, I had a question, and I am not a vet, so this information is not, for me, valuable, very insightful. But I did wonder about, like, with the American Legion and Veterans for Foreign Wars, does he or Kyle think has something to do with generational differences? If you're walking into, you know, Chris, or one of these other places, are the people there generally of an older generation? And therefore, if Kyle is, I would call a younger generation person, so are some of the differences between the two because of generation?
Yeah, I do think, you know, from what I've seen, yeah, there is a big generational divide. Not every American Legion or VFW is all, you know, Korea or Vietnam vets or, you know, pre 9/11. There's certainly a lot that do recruit younger veterans, but you know, I think those organizations have actually been pretty open about, you know, their difficulty in doing so, despite the fact that there are some posts that they have that are well represented. I do think that is part of it. You know, without getting too deep into a conversation about generational differences in politics, you know, I think it would be safe for us to say that, you know, pre 9/11 generations of veterans came up during a time where I think it was, I guess, this view that privatization was kind of the fix all, right? And that you can kind of privatize your way out of a lot of problems. And my generation is certainly, I think, a bit more skeptical of that. But again, I don't want us to view those generations as folks who are not amicable on this issue, because again, some of the fiercest, actually, to be honest, the fiercest advocates I know for VA healthcare and protecting it are Vietnam veterans. And to be frank, one of the main reasons why is, you know, I think also it's a bit of a sample set bias. My generation is still young and you know, we're not dealing with as many health issues. So we probably don't, the urgency of needing this VA and the urgency of healthcare probably isn't as present in my generation. But I would say, yeah, I mean, there's some of it that comes along with just the politics of different generations, but you know, you'd be surprised, I think, when you go into the VA, or excuse me, into some of these VSO spaces, that a lot of these veterans, they can be very conservative on certain issues. They can be very right-wing on certain issues. But the fact is, they've gone to the VA. They've dealt with the VA. They know that their care is going to be solid there. They trust the people there. And they also trust the fact that the VA has a lot of people who also served. So when they're talking to some of the people there, they have a higher chance of running into someone who was in the Navy, like, or understood why they have tinnitus from being a machinist mate in the bottom of a ship, you know, or was a Marine themselves and understands, you know, like just what it's like. And that little added extra bit of care comes across as well. So, you know, when we talk about protecting the VA, it really is an intergenerational thing, but, you know, yeah, I mean, there's some things you could tease out of it, but yeah, it's definitely intergenerational.
Well, and also, I mean, what's really interesting is when we talk about other than honorable discharges, you know, the VFW, the Legion, AMVETS, not Vietnam Veterans of America. I can't remember if PVA, Paralyzed Veterans of America, is part of this, but certainly the Legion, Disabled American Veterans, Legion, and AMVETS, you can't be a member of any of those organizations if you have an other than honorable discharge. And, you know, it's interesting. I mean, vets can be really hard on each other. I mean, you know, it's kind of like, you know, you think, I mean, you know, women are, as a woman, women are always touted as, oh, you know, you have women in charge and they're going to be sort of bipartisan and kind to each other. And it's like, really? I mean, we may not get into fistfights and kill each other, but we can kind of be crappy to each other in other ways. And I find that vets can be really hard on each other. There's huge pecking order in the veteran community, you know, like who was in combat. I mean, Kyle is, you know, at sort of the top. And then I have a Vietnam vet friend who was in force recon out there in the jungle in these little teams of 6 people. And, you know, he is like, oh, I don't want to be with these Vietnam vet wannabes, you know, who somehow weren't out. I mean, you know, so there's a lot of pecking order, and a lot of people are very hard on each other. And I mean, one of the things that I think we're for is that, you know, any vet should be able to get into the VA regardless of their discharge. I mean, obviously, maybe if they're, you know, a serial killer or something, but, you know, very few of those. And, but there are a lot of vets out there, you know, who are like, oh, you know, he got another, then he made bad choices, you know, and so forth. So, I mean, but then there's, you know, a huge amount of progressive vets. And, you know, I think that maybe a question for Kyle is, you know, if one of your groups wanted to go talk to vets, I mean, obviously you have members in Michigan and Wisconsin and stuff like that. I mean, maybe folks could come to Common Defense and say, you know, we would like to partner with a progressive vets who's for Medicare for all. I mean, I think it would be great if some group in Medicare for all, I mean, there's so many who are supporters, you know, if there was a group called Veterans for Medicare for All, there was a Vets for Bernie, for example. And, you know, that would be very powerful, I think. I mean, I think the other point I wanted to make before we get to the other questions is that one of the really good ways to show that you're for vets, that you care about veterans issues, is to start with opposing some of the stuff that's going on to privatize the VA. There's a huge discussion right now because the VA secretary, part of this Mission Act of 2018, was a part of it called the Asset and Infrastructure Review Commission, where they're looking at, and again, this was Trump legislation that the Biden administration is tragically implementing. They are looking at what VAs to close, and they're threatening to close VAs all over the country, in Michigan, in Wisconsin. I'm going to put in a link here for you because there's recommendations, and you can hit this link and go down and look at your state and where they want to close VAs. And vets all over the country are protesting this. And you can join that. I mean, you can, you know, Medicare for All folks can, when they're talking to Congress about Medicare for All, they can also talk about, you know, do not close VAs, do not do to the VA what they're doing to traditional Medicare through direct contracting entities. And that's another way to show vets that you're on their side. And you will meet, I mean, if there's a rally in front of a hospital, right, to protect that hospital, or in front of somebody, I mean, there have been in Brooklyn, there have been in Manhattan, you know, folks who are Medicare for All activists can show up there. And that's another way, I mean, there's gonna be vets there, you know. I think Karen had her hand up, or Kay or something. Karen?
Yeah, so I was thinking about just if I'm talking to a vet, I just wanted to re-familiarize myself with, I know at some point, like there's a policy or some kind of policy that when you're hurt in the military, it's actually, it's more beneficial to you to get the correct amount of care the sooner you flag that you were hurt in the military. But as we know, injuries and health doesn't always work that way. Sometimes like you hurt your back and then you might like experience progressive like pain and you might not realize it until a few years later. So if I'm talking to another vet, I think that it's good to point out like just some of those rules that are stopping legitimate, like vets who are legitimately hurt from getting care because at the time they didn't realize that 10 years from now that knee was going to act up because they jumped out of an airplane and landed wrong. So I do kind of like to know some of those little like policy things that they like gates that they have for people, and sometimes like there's certain time limits where you have to sign up for things. So I was just curious. I guess I could ask my husband too, but I know a little bit about them, but I was curious, like, are there any stories that you know of people that like legitimately were injured, however, but they couldn't get care because they missed some kind of gate?
Mm-hmm. Yeah, this definitely happens. Matter of fact, I could give a brief, story of my own experiences. Well, first to get to the specifics of your question, I don't know all the specific policies, but yeah. I do know that there's a real issue with veterans in terms of, as Suzanne just mentioned this, we're really hard on one another, and there's a very, like potent culture around just like suck it up. Some people had it worse, you know what I mean? Like you didn't have it that bad, so you shouldn't complain. And I, embodied that myself when I first got out. When I first got out, I only asked for the things that I thought, oh, well, I know this one I can prove, and I know this one I can. And I also had a lot of denial about some of the, personal like trauma and issues and like anxieties that I brought home from Afghanistan. And it wasn't until literally 6-7 years after my first initial, time at the VA that I went back, and I was very nervous because I was thinking, well, I don't know if I've passed this threshold. I don't know if I passed this time. Maybe it's too long. Maybe they won't cover me, and I was fortunate in the fact that, fortunate in the fact of two things. One, the VA, again, that I work with in East Orange is very helpful. My personal doctor is great. But I was also very fortunate that, and this really highlights how arbitrary this is and how much that really undermines the whole point of the process. When you're an infantryman who went to Afghanistan, they kind of just take your word for it, because again, as Suzanne mentioned, the pecking order, I am towards the top. So they're like, oh, well, he's saying this hurt. He did this tough stuff. So we're just going to get, we'll just move him on. But that is not the way the system should work in terms of determining how we get care. And that's one of the major problems. That's why we should have Medicare for all, because then we don't have to worry about whether or not you're in the right pecking order. Because I'll tell you, there was a guy, his name was Val Morale. We called him Valtierra was his last name. He was a cook, and he went on all the patrols with us, and he made pizzas for us, but he was not an infantryman. So when you saw his paperwork, you might have thought that this is a sort of guy who was not, out there in a tough situation, but he absolutely was. And he went from patrol base to patrol base making pizzas out of scratch, and we loved him to death, right? But he's not going to get that same sort of deference that I might have gotten. And that is one of the issues, right?
So the policies, and this illustrates just why all vets should get care. And even under Medicare for all, I think all vets should get care because the VA specializes in their care. So I would argue that, if we have Medicare for all of us who are for Medicare for all should also argue for changes in eligibility in the VA. Because even though, right now, what you're sort of referring to, Karen, is that right now, anybody who served in a combat zone, and they don't have to have been shooting people, they could be the pizza cook, right? They get 6 years or something free care at the VA, and they're never going to be kicked out, right? But if you were, if you hurt yourself in Fort Hood or Fort this or Fort that in the United States, or you were sexually assaulted, or you had PTSD because of these brutal training measurements, you have to have a paper trail to prove that something happened to you. And the problem is, as Kyle said, in the military, people are discouraged. This is the DOD side. They are discouraged from going to the medic, from going to the doctor, because you're a sick call ranger, you're a wuss, I won't go into the other things they call people, very misogynist. And, you know, they discourage each other. I mean, one young Marine who never left the United States said, you know, people really look down on you unless you had a compound fracture where your bone was sticking out. I mean, I don't know if you had this t-shirt, Kyle, but the Marine Corps has this t-shirt that they give to poolies, to recruits. And it says, pain is weakness leaving the body. So, and basically nobody tells these young military service members, if you hurt your ankle, go to the doctor so that you can get the paper trail. Because, you know, you're 18-year-old, you know, macho man or woman, and, you know, you're invincible, and you don't realize that knee that, you know, you hurt when you parachuted or whatever is going to bother you when you're 50, right? So this is a huge problem. It's the hugest problem. And also getting folks, I mean, mental health, boy, if you think it's bad with your knee, I mean, if it's your mind, I have sat in rooms with 50 Vietnam vets who suffered from PTSD for decades. I mean, heart-wrenching stories, you know, and 3 months ago, they came to the VA, 5 months ago, 5 years ago. So, you know, we need the VA to be available to the Kyles, you know, when Kyle is 60, who, you know, I mean, not this Kyle, because he, you know, the men and women who have been in denial for 4 decades, and then suddenly something happens and they realize they need help. The VA may be underutilized now by some of these folks, but boy, when they get sick or old, and you get sicker when you're older, we need it to be there, because that's the pattern, you know.
I never really thought about that culture piece. So that's why I'm here in this room. So the culture predispositions everyone to acting a certain way, but the official policy, it does not take into account any kind of like what the culture is like and what's happening in reality. That's interesting to me.
Yeah, I mean,
I'd like to add, can I add a point too? My sister-in-law would have died of a burst appendix had her mother not suspected something's not right here and brought her to the emergency room. But her thinking, my sister-in-law's thinking at the time, and she was in high school, was, you know, just because I'm not feeling well, I don't need to be rushing to a hospital or to a doctor for care. I don't need to be doing this. I don't need to be doing that. So what I'm getting at is this culture that you're speaking of doesn't stay within the military. It spreads to their families, to their friends, to who knows who else. And somebody's life could be in the balance because they're misinformed or conditioned to, oh, you know, you don't need to go see a doctor, that kind of thing. So we need to be aware that those things do ripple out.
And I think that what Kyle said is, I mean, we also need to be aware, and I found that, I don't mean to toot my own horn, but if you want to know more about the VA and about the veteran population, I really would recommend reading my book, Wounds of War. And it tells you what the VA is and what a great system it is, but also vets are very different, you know, they are a different population. They need the VA. So if you're arguing for Medicare for all, never ever say to a vet, and I have heard some Medicare for all people say this, oh, you know, the VA will disappear in Medicare for all. Never say that, never wish it. Because as long as we have a military, an imperial military with so many people suffering from so many problems from a reckless employer, you need a population-based health system that serves those people. The VA is like pediatric hospitals or oncology hospitals. Vets have very specific problems. A patient isn't a patient isn't a patient. They're very different. And I want to recognize Kay because we only have 6 more minutes, I think. So Kay, it's lovely to see you. Kay Tillow, would you have a question or a comment?
Can you hear?
Yes.
Mhm.
Yeah, thank you for this program. And I appreciate the work that you're doing, both of you. I think that what's really, really, really important to those of us who've worked in the single payer movement for a very long time is that we have to catch that common thread of privatization. We're seeing it now between not just for the veterans, but for our Medicare through this direct contracting entities. That is virtually, there is a plan to privatize all of Medicare and turn it over to the for-profit companies by 2030. And I think that that's a common fight. The anti-privatization fight for the veterans, for our Medicare, and it links to what's basically wrong with our healthcare system is that for-profit entities are in there, making it too expensive and much inaccessible. And it's designed for profit and not for care. So it seems it's the common link that can connect our country in a common fight to remove these privatizers and these to move towards a publicly accountable system that covers us all. So I appreciate the work that's being done with the VA, and I think that's a thing that we should take up.
And I want to point out that when you're arguing with vets and when you're arguing with folks in Congress, you have to be very careful because they understand. I mean, unlike in the education debate with charter schools, vets don't like privatization. It really is a P word, right? And so it's very important because these Congress people who are voting to privatize the VA will say, oh, I'm not for privatization. I'm not for privatization. And they define privatization as the total sell-off of the VA tomorrow. We're going to shut the whole thing down. We're going to sell off the land, lay off the folks. And what you have to be very careful is saying, no, privatization is a spectrum of activities where you give parts of public services to the private sector paid for by the public, right? And so I think I just want to say when you're talking to Congress people, folks like John Tester, who voted for these privatization bills, IAVA, Iraq and Afghanistan Veterans for the War, Iraq and Afghanistan Veterans of America, which is a new VSO that is kind of supported by corporate donations, including healthcare companies. They will say they will lobby for privatization bills and say they're not privatizers. And so it's very important to say, wait a minute, any shifting of control and services and money from the public to the private sector, when the public sector could, if it had that money, and even more, give even better service, that's privatization. So we always talk about privatization and outsourcing in veterans care, because these people are so, even, the Koch brothers, Concerned Veterans for America, says they're not for privatization of the VA while they're fighting for it. What they use, but it's the same playbook, Kay, it's choice. We want to give you choice, Yeah. But we want to eliminate the VA as one of your choices while we're giving you a choice. Yeah. We have I believe it's 2 more minutes. So I'd love to give Kyle an opportunity to give some last minute, insights or inspiration. Kyle.
Yeah. Well, I'll tell you, I think, Suzanne just brought up a great point. If the Koch brothers are afraid to say privatization, there's a reason why, right? And it's because they know that a majority of veterans do not want this. And veterans are smart. They care about their VA. They've seen a lot of these, they've seen a lot of this stuff in the past. And, it's funny, you get, to be completely frank, I've been around some conservative veterans who they snap into this weird space of class consciousness the second you talk about privatizing the VA, where they're like, well, these rich folk are going to come in and they're just going to siphon off what. And I'm like, wow, that was really, I wish you kind of understood this for other issues, but this is something that I think, you can tap into, and, it's something that we would like to do more of and we're actually discussing this, how we can do more in terms of using this discussion about the VA to further that fight for Medicare for all. Because again, what they're trying to do in the VA is what they have already done in so many other spaces, right? And it's what is now the status quo for most citizens in this country and how they get their health care. That a business whose business model is made on denying care is the one who's going to determine, you know, whether or not you get health care, right? And again, veterans understand this. They're excellent messengers. They're great people to take this message forward. And it's, you know, what we believe here is a great way for us to further the progressive movement. So
right. So thank you so much, Kyle, and thank you so much, everybody, for coming. I don't know how, I guess we all just leave and then we've left.
Okay.
And so let's do a Vets for Medicare for All, you know, and personally, I think it should be VA for all, but that's another time. That's for another time. Take care.